Hello friends, I am Dr. Archana Prabhu, obstetrician and gynecologist practicing in Mumbai for last 18 years. Friends, as you all know, as science advances, we have taken control of many diseases. We could eradicate some of them, but we could gain some diseases as lifestyle is changing. One of them is diabetes. Yes, diabetes is getting day by day common. Today I would like to discuss about diabetes in pregnancy. We all know what is diabetes. Abnormal blood sugar levels, we call them diabetes. But when diabetes happens in pregnancy, what can go wrong? Diabetes in pregnancy will affect mother as well as baby. Here, as we go to the cell, we take buy one, get one. Here we are having one disease and two people are affecting, mother and the baby. So what can go wrong when mother is diabetic and no one knows about it, neither mother nor doctor? Here this baby is exposed to high blood sugar levels of mother. If this baby is exposed to these sugar levels in its very early life, like in first 3 months of pregnancy, there are very high chances of developing structural abnormalities in this baby. We call them congenital malformations. What else can go wrong? This mother may go into abortions. If this baby survives, there are n numbers of complications which can happen. Like there could be growth issues to this baby. Most of the baby may not gain proper weight during the pregnancy. We call them small for date babies. Sometimes diabetic mother's baby may gain excessive weight and we call them large for date babies. There could be issues related with the amniotic fluid. That may be excess amniotic fluid around the baby. We call them polyhydramnios. Then at birth, this baby may develop many other complications. This baby may develop jaundice, this may be undergo hypoglycemia, this baby may develop deficiency of calcium, this baby may develop many infections like respiratory and so other. What can go wrong with the mother? If mother is having high blood sugar levels, she may develop later in pregnancy hypertension. This may undergo preeclampsia also. This mother is again exposed to many complications like infection. She may also go into hypoglycemia because of her fluctuating blood sugar levels. This mother may go into sometime coma. See friends, pregnancy is a very exciting experience. Everyone is so thrilled about pregnancy, but this pregnancy can really turn into a nightmare due to diabetes. There could be sudden intrauterine fetal death. That is the utmost complication of fluctuating blood sugar levels in mother. So, how to control all these complications? Here very important thing is, as soon as you come to know you are pregnant, immediately go to your doctor and a blood sugar test is to be done. There is a screening test which every expectant mother should undergo. That is, we give 75 grams of glucose to these women, need not to be fasting. After 2 hours of it, they should give blood. Those blood sugar levels will let you know whether you are coming into the zone of impaired sugar levels or diabetes or not. If your blood sugar levels come under borderline region, initial treatment is by the diet and exercise. Proper diet, which is lot of proteins, less of carbohydrate and fat, with lot of green leafy vegetables and fibers. Exercise, there should be a routine and regular exercise, antenatal exercises which are appropriate for that month of pregnancy should be learned and should be done regularly. Then comes, if your blood sugar levels do not come under control by these measures, or if initially only they are very high, we have to start the treatment. The treatment is only and only insulin. When there is diabetes in pregnancy, the insulin is the right choice and the first choice of treatment. Don't get afraid of it. Most of us are afraid of injections and the insulin, but believe me, it is the best choice. It will keep your blood sugar levels at controlled throughout the day, and it can really check the complications. It's very easy nowadays. Many pens and the instruments are available for taking insulin. You can learn them and take it at home. The levels are to be controlled by the doctor. They will advise, they will adjust the dose according to your blood sugar levels. Then comes the role of monitoring. You have to keep on checking with your gynecologist routinely, as they call you, maybe weekly, maybe fortnightly. But very important part here is self-monitoring of blood sugar levels, because you are the one who is there with your baby 24 hours. So you will be the best judge. Do your blood sugar levels at least 2 to 3 times a day, but at different part of the time. Like sometime you may do it before breakfast, sometime after lunch, sometime before dinner, sometime after dinner. This way we'll come to know the levels throughout your day. So different days you do different levels, sometime before, sometime after. And if your levels are under control, what is that control limit? Usually less than 90 milligram of percent of blood sugar if it is fasting, and if it is random or after lunch, it should be less than 120 milligram. If you are keeping your blood sugar level at this limit, you are doing proper exercises, taking proper diet, this complication of the pregnancy we can really keep at check. Okay friends, the thing is that diabetes incidence, what we know in pregnancy, is just a tip of the iceberg, because most of the cases remain undiagnosed, undetected. That's why as soon as you are pregnant, even if you are not having any kind of high risk or complications, check your blood sugar levels, go to the doctor, follow the instructions. You can really keep your pregnancy safe and exciting rather than turning into a nightmare. For more information, you can contact me on lybrate.com. Thank you very much.